actually designing this pediatrics residency to be pretty unique among pediatric residencies across the U.S. Most pediatric residencies are very much ivory tower situated within a medical school or a children's hospital. Our pediatric residency is actually going to be based out of a federally qualified health center, and there's almost none of those across the country. We're one of the very first. The result of that is that our pediatric residency is going to be very community-facing and community-based, with more of an emphasis on outpatient clinical care, more of an emphasis on continuity and really getting to know your patients and families that you're taking care of.
Because Pediatric Residency of Idaho is located at a federally qualified health center, there will be a large number of underserved patients that are seen there, specifically patients who maybe historically have been underinsured or uninsured and are now on Medicaid. We also have a large variety of different populations that are historically underserved by the medical system. So we have transgender patients and gender diverse patients. We have an HIV clinic.
There's also a very large refugee population. Idaho is one of the largest resettlement of refugees and has been for quite some time. And there's even charts of like the different refugees that have come through Idaho at different years and different states, so at different times, which really brings a large mix to our population here.
So we end up serving a huge variety of patients with a great deal of diversity. I mean, it really is an incredible spectrum and gamut of patients that we take care of.
I think from a learning standpoint, working with folks who may come from different backgrounds than you is always a great experience in terms of increasing the breadth of patients that you're able to serve. I think one of the key components of working with underserved populations is that you have to meet them where they're at. So they may not necessarily be able to follow the protocol for that the AAP lines out or that up-to-date lines out for how to treat this certain kind of illness. And you have to really figure out what's going to work for them.